everyone. I'm Laura Sessoms. I'm the Chief Care Transformation Medical Director of Payment Innovation at Anthem. Anthem is proud to present the PCC's Barbara Starfield Primary Care Leadership Award. The Starfield Award is presented annually to an individual who demonstrates exceptional work towards advancing the goals of primary care, and in particular, a strong commitment to person-focused care. It's my privilege to announce that Dr. Rebecca Etz is the winner of this year's Barbara Starfield Primary Care Leadership Award. I can say that Becca is the embodiment of the values this award represents. During the beginning of the pandemic, she and her colleagues demonstrated extraordinary service to the advancement of primary care by launching and disseminating the results of the COVID-19 survey, providing ongoing data on the devastating impact of the pandemic on primary care practices, staff, and patients. These data were extremely valuable in driving policy changes within government and elsewhere, including Anthem, to provide a lifeline to primary care. Now we will hear from several of Dr. Etz's colleagues who will share a bit more about her and why she is so worthy of being this year's recipient.
I've known Dr. Rebecca Etz for about a decade and a half. Rebecca Etz is indeed unique. Her intellect, plus her imagination, plus her background and experience in architecture, anthropology, measurement, and primary care make her unique.
Rebecca gets it. She gets the micro, she gets the macro, and she has that unusual ability to toggle in between. And you know, especially for researchers, and especially for researchers who have to communicate complex topics to policymakers, it's the rare one that knows how to do that. And Rebecca knows how to do that, and she knows how to do it with heart.
She brings you in, she's empathetic, she listens to understand versus asking questions, and really creates that empathetic and trusting environment.
I really feel like Barbara Starfield, she shines a light on how central primary care is to our health outcomes and to our country's healthcare system.
She has furthered the field.
Congratulations, Rebecca, and thank you for what you've done and what you're going to do for primary care.
For being the happy warrior that you are, in the service, always in the service of the patients that we all serve.
For your vision and really seeing what was needed this year.
It's just been an honor and a privilege to know you, to work with you, and be able to say, I know Rebecca Etz, and I know the work she's done for primary care.
Now you've just heard about so many amazing things that Dr. Etz has done. Please join me in congratulating her on this prestigious award.
Wow. This was really unexpected and incredibly humbling. And I've actually struggled with how to respond. So on the one hand, there's nothing that I've done by myself. And I would really thank the PCC for the honor and those who were part of the nomination. On the other hand, I thought about what it means to be at this table. And if you know me, you know I believe there's no point in being at the table if you're not going to speak. So here's my compromise. I want to thank the people who suffered most. My wife and soulmate, Martha, my friend and partner in crime, Kurt, my coaches, colleagues, and dear friends, Larry, Will, Frank, Christine, David, Linda, Sarah, Tony, Jonathan, Asaf, Ann, Jill, Denise, Jan, Diane, Bob, and Bob. And I could go on, but I'm not going to because I need to speak. So here's the thing. Primary care is about generosity of spirit and recognition of humanity. It's relational. It's teams and care teams worthy of the public trust. It's grounding and being known and being fully present, allowing both growth and vulnerability to occupy space with dignity. To grow, you have to be willing to risk. Fast forward to March 13th of this year, my team was having its weekly meeting and a national emergency was declared. We knew primary care was about to be hit, and we knew how fragile it was. No national funder, no national center, no national database, no front door, and internal bickering about direction and self-definition. Truly, it's heartbreaking. So we acted and we launched a survey to capture the experience of primary care during the first pandemic of our lifetimes. I can't stress enough how important it is to have the ability to act and be nimble and find support and share what we know. We had seed funding from the ABFM Foundation that made acting possible. And we had just-in-time funding from the Morris Singer Foundation and Samueli Foundation to keep that work going. We designed the first survey, submitted it to IRB, received approval, distributed it to about 5,000, within a 10-hour window. And then we reached out to Ann at the PCC for help. And they jumped in. They helped us to support distribution, issue press releases, and stand up a website that would increase our dissemination many-fold over. There was no question. It's a powerful collaboration that still continues. And we reached out to societies and boards, many of whom are listening to me now. You helped support it. You encouraged your members and diplomats to complete it. And then you used the data we shared with you to advocate for resources and for better. And there was no question. Information changed daily, sometimes hourly. National coordination was not happening. A rapid transition from telehealth and new software and workflow and questions and unknown virus with an unknown treatment. And our survey launched on a Friday night at 7 p.m., the day the national emergency was declared. And by Monday morning, over 500 clinicians had given us their time. It's their generosity, their willingness to be vulnerable, and their trust in our team that has made this work possible. Not just family medicine, not just doctors. The big tent of primary care stood next to us and answered the call. They rallied around us with the support of PCC and so many other partners, and I have a list of over 200 that gave of their work and time in kind to help us advance. We're in the midst of a horrible surge right now that is exacting yet another toll on a tired and heroic workforce, and yet over 1,400 responded to our last survey. Not just me. Not just one person. But here's what I really want you to know. We are different and the rate of change accelerates. Black Lives Matter, presidential administration change, and a pandemic. And I hear from patients who make appointments in primary care because the foundation of their world feels like shifting sand, and they turn to the relationship worthy of their trust. And I hear from doctors who pull over their cars to the side of the road to cry on their way to work and then go there and tolerate the dithering of whether to support telehealth parity for 3 months or for 4, while they don plastic bags and use coffee filters as masks because they have no PPE, but they are worthy of the public's trust. They are forgoing salaries and working long hours and doing telehealth visits from home while they too suffer from the virus. They're waiving fees for people who need but can't pay. They're getting involved to help with food insecurity and housing and a growing mental health crisis that we have yet to begin to understand. And they continue to do it every day while leaders continue to debate whether they have any pennies to help. And in that frenzy of activity, I see the inspiration that lit my soul as a kid when I first fell in love with primary care. Generosity, vulnerability, dignity, and the will to act in the interest of the public good. I have truly been humbled by what they have accomplished together and the way they toil together on social problems that matter. What I need you most to know is that we are changed. The world has changed, and that's just a fact. But how we act in the face of that change is what matters. And are we willing to accept the unacceptable is the question. And I know, because you taught me, the relational is about moving from the factual to the meaningful. Primary care is meaningful. It is worthy of the public trust. It recognizes the dignity of our common humanity and does so with the generosity of spirit. I want to thank you for this award and for the partnership of the PCC. And I want to thank everyone for teaching me this valuable lesson and for the opportunity to remind you of it. I promise I will continue to reflect on that mission, and I will tell you now that I will partner with anyone who shares that common interest. Thanks.